Hi, welcome. Thanks for joining me. My name is Dr. Samantha Pillay. I'm a urologist or urological surgeon. And since 2002, I've been managing patients with urinary incontinence and practicing in the subspecialty of female urology. I am passionate about healthcare education in this area. And there's a couple of reasons. First of all, it's an enormous problem in our society. In Australia, it affects almost a quarter of the adult population. 1 in 3 women who've had a baby. And if you look at women aged 50 to 59 years of age, it's 55%, more than half, and it increases with age. Incontinence is a huge burden on our economy and on individuals and on our healthcare system. It causes depression and social isolation, participation in the workforce, ability to exercise, sexual relationships, and one of the most common reasons for people to be admitted to aged care. The problem is that majority of people that have urinary incontinence actually don't seek help. And there's a lot of courses now and certificates and qualifications for people who specialise in this area. But I'm passionate about bringing healthcare education to every health professional because incontinence is so common. If you see patients, then you see patients with urinary incontinence. And it's not just the stigma and the embarrassment. Your patients actually don't want to tell you, even if you ask them. So by being educated about incontinence, you're going to be in a better position to be able to have a conversation and evaluate your patients. And I've always felt that this area just doesn't get the attention that it deserves in healthcare education. I still talk to students who say to me, in a 6-year medical degree, they got 1 lecture or half a day. And yet we're talking about a condition that's more common than diabetes, asthma, hypertension, even cancer. So there really could be a lot more focus in that education, and that will make health professionals more confident to actually have a conversation and lead the conversation with the patients, especially when the patient actually doesn't want to lead that conversation. So I've created this course for you, for the general health professional, to be able to feel confident talking and managing urinary incontinence in their patients. I've broken it down into lots of small little topics and modules so that it's easy for you to digest and you can work through at your own pace, at home, wherever you like, in your own space. And I've created a number of downloads for you that you can use in your practice. So since 2002, I've given over 130 lectures, and I'm very excited to be able to present it in this format that's easily available and accessible to you, no matter where you are around the world. In that time, I've also created a number of different patient information sheets for my patients. And these are the downloads that you can modify and use in your practice. You can make them your own, put your own logo or header on there, and they're going to be a starting block for you. As a health professional, you're going to still be responsible for what's in those downloads. There's some things that are expert opinion. Research and data can change over time. Treatments can change over time. So you'll be responsible for making sure that you're happy with the content, but it's a great head start and it's going to save you loads of time. So let's get started.